Yesterday, His Excellency President Uhuru Kenyatta outlined a raft of new measures to contain the spread of coronavirus in the country. Such measures, among others, include the restriction of movement into and out of designated counties of Nairobi, Mombasa, Kwale, and Kilifi. It is important that we all, as Kenyans, adhere to these measures if we are to score significant gains against this monster and keep our country safe. Each and every one of us, and collectively as a country, we are now called to observe and watch over these measures. Let us not shy away to point out those in our midst who are not observing the measure and thereby putting the nation at risk. In line with the pronouncement by the President of the importance of wearing face masks, let me reiterate that it is critically necessary that every Kenyan wears a face mask whilst in public spaces. Everyone must make the effort to get a mask to protect themselves and others, as we endeavor to provide them some where we can, free of charge, through our county governments and other partners. The measures announced so far call for drastic change in the way we live and the way we behave. It is not convenient, ladies and gentlemen, fellow Kenyans, but we must not be afraid to embrace that which will save us from the danger lurking around us. We are at war with an enemy that is invisible. To fight this enemy, more than ever before, we must remember to embrace simple and basic measures which have proved to be effective elsewhere and have been cited as best practice. These include washing our hands with soap and running water, as well as keeping social distancing. Let me say this: we will not hesitate to take even bolder measures in the coming days. The virus is already here with us, and we cannot run away from it. It is around us, and we have embarked with it a chasing game. Should we allow this to happen, it will be very, very difficult for us to catch up with it. I want to take this opportunity to once again thank our healthcare workers in public, private, and mission hospitals who have worked tirelessly and sometimes under very difficult circumstances. We would not have been able to make the gains that we have had it not been for their dedication. Being our frontline heroes, I want to assure them that we will do everything possible to provide them with every facility that is necessary to enhance their performance. I also want to thank the Ministry of Transport, Infrastructure, Housing and Urban Development, and the county government of Mombasa, and indeed their governor, Governor Joho, for the collaborative effort to provide disinfectant sprayers at Likoni Ferry. Such efforts contribute to the overall measures by the ministry to fight the virus. I would like to encourage other counties to also come up with innovative ways to complement the national government efforts. In the same vein, I also want to take the opportunity to recognize the efforts by the Ministry of Information, Communication, Technology, Innovation and Youth Affairs, together with the Ministry of Education, as well as the Kenya Institute of Curriculum Development, for introducing new education-oriented programs on television and radio to ensure that our children are productively engaged during this period. Further measures to enhance social distancing that we are going to institute must now include even the following. Number one is that in sporting clubs, open air sporting clubs that have walking fields and so on, must strictly observe social distancing. We have seen people walking, and yes, it is necessary that people also stay healthy, but we must observe social distancing. We have observed in some walking clubs where people are running next to each other, and there is no better way of passing this virus than when they do so. So I would like to ask, and I would like to reiterate, that the managers of those walking clubs must restrict numbers in the club so that people do not, people can be able to keep social distancing. This measure we are going to observe for the next couple of days and may then take further measures if it becomes necessary. You are aware, it's not a secret that even in golf clubs have also been abused. Consequently, all golf clubs must be closed with immediate effect. Golfers are free to walk, keeping social distances, but there will be no candies in any of those golf clubs. In this particular case, it is actually the reverse. It is the members who will eventually pass the virus to the caddies, and therefore golf clubs will remain closed and the clubhouses will remain closed. Further, testing of all health workers and medical staff, including those in private hospitals, rapid response teams, and all staff in all facilities holding quarantined persons must commence testing with immediate effect. I would like to report that we are lucky that we have started rapid testing in our facilities because we have got new reagents that can allow us to automatically test and not do the manual test that we have been doing. And for that reason, we will be able to carry out those tests very quickly. But it is important that we start with our medical staff, even as we fight to ask them that to be careful. We must also now ensure that we do not have medical staff who are also treating people when they have got the virus and therefore passing the virus to citizens. So we must do that with immediate effect. I am pleased to report that over the last 24 hours, three patients who had been diagnosed as positive have been released from our facilities, having turned negative. However, in the same 24 hours, we have tested 696 samples, out of which 14 people have tested positive for the disease. 12 of the 14 are Kenyans, while 2 are foreign nationals. Of the 4 cases, four cases have a recent history of travel from Tanzania, South Africa, UAE, and the United States. 4 of them are from quarantine facilities, while 10 were picked by our surveillance teams. This now brings the total number of those who have tested positive for the disease in Kenya to 172. The 14 people that I mentioned have already been moved to isolation facilities, and contact tracing has begun honestly. Fellow Kenyans, let us brace ourselves for bad news. Let us be ready, because all the measures that we are going to take will not stop the disease abruptly. It is already here with us. There are two things that are fortunate for us. One is that the disease that Kenyans are getting is very mild. We have been getting very mild. Out of the 14 people that I mentioned, for instance, 7 are from Nairobi. Mombasa has 2 new ones. Machakos has 1. Kisii has 1. Kiambu has 1. And Mandera has 2 cases. And the 2 reported cases from Mandera is a recent travel from Mombasa County. That explains why the decision by the president was taken yesterday to close some of the areas where we feel people moving into and out of are causing further spread of the virus. I'm also pleased about the cooperation we are getting from members of the press, members of the media. We are happy that you continue to carry out education, to carry out information, and to keep our people informed about the measures and the necessity of those measures. We are not going to be dealing with this disease only for the next couple of weeks. Let us brace ourselves for the long term. And by a long term, I mean for the next couple of months.
So majority of our cases are still very mild cases. Of course, if you look at the age distribution, the youngest has been 2 years old. The oldest is 74 years old. A male to female ratio of about 56-44. So more men and fewer women. And of course, we know the reason why we have that male-female distribution. Our case fatality rate has been about 2 to 3%, which compares very, very favorably with other countries. In the early stages of the infection, in which case you are dealing with smaller numbers, and therefore the crude death rate or the case fatality rate tends to be low. In terms of quarantine, let me just also add that though this is a painful measure for those whose duration of quarantine has been extended, it is a painful measure that we had to take, but it is for the good of the Kenyan people. I also want to applaud those who actually bore the covenant of respecting the quarantine instructions, those who came like from hotels like Trademark in Gigiri, Hill Park Hotel, where there was no single case that tested positive. And as today, we have started releasing those people home. We want to assure you again, especially those who are in quarantine, to ensure that you follow the social distancing rules, the infection prevention control measures, the hand washing, and very soon we are going to again check on you after the 10th day to see if you are negative. Working together with the county governments, we shall be able to release you to go home and continue with self-quarantine in conjunction with the county health management teams and follow-up from the team at the national level. We have identified suitable accommodation at one of the hotels is Hadassah Hotel, just next to Nairobi Hospital, for the healthcare workers. And the team at the Kenya Medical Practitioners Dentist Council, chaired by Dr. Evan Jenga, are working extra hard to be able to get us extra facilities so that healthcare workers who get into contact with these cases don't go home, but go to a specific place and therefore prevent cross-contamination with members of the family and the public as they move home. In terms of the distribution of the PPEs, of course, it is on case-by-case basis. The demand so far in terms of the numbers we have, Nairobi will take a bigger chunk of the PPEs because we have higher numbers in Nairobi, but we'll also be able to deploy a significant number of PPEs to Kwale, Kilifi, Mombasa, Nakuru, where we also have active cases, and any other place where we think based on a risk matrix that we have developed. Thank you.